I thought about how I might introduce you, and I just don't think I could do it justice. Like, I would just end up rambling for 5 minutes. So I'm going to let you introduce yourself. So tell us a little bit about you.
Oh, thank you so much. I'm really happy to be here. Yeah,
Happy you're here too.
yeah. I'm Dr. Ethan Wonuk Hwang, and I'm the head director of the Cheongdam Lebelle Clinic in Seoul, in Gangnam area. And yeah, I'm a cosmetic physician. And my work focuses on aesthetic medicine and regenerative approaches and long-term structural rejuvenation rather than short-term cosmetic correction. So, which means, in other words, I'm less interested in treatment that looks dramatic for a few weeks and more focused on helping patients age in natural, healthy, and sustainable way. So, I mostly and clinically, I spend a lot of time thinking about how to improve skin quality and tissue support and overall facial balance through layered treatment planning. So that can be injectables, which is very trendy in Korea, and energy-based device, and regenerative approaches like stem cells. We're gonna talk about.
We're going to get into the stem cells today.
So more importantly, you start with diagnosis always. So I believe the best treatment is not just a famous one, but the one that truly matches the patient. So that's always I think about and always most focus on. So, yeah.
Awesome. I think one of my favorite things that you've ever said is that your treatment doesn't stop at the airport.
Yeah, I'm gonna. Yeah.
Oh, you're gonna say that later? Okay.
Yeah. Okay. That was my word, actually.
That's just one of the best, one of my favorite things you ever said. And I think, too, you have a really interesting perspective, and you'll talk about this a little bit more as well, but, you have a lot of international patients. You've also had, other doctors come from other countries to train with you. You've been sent to other countries to train. So you have a very well-rounded perspective on not only like clinical K-beauty, but just K-beauty in general. So I think we're going to start off with a very large question, which is, what is K-beauty? How do you define K-beauty?
Every editors always ask me about that. What is K-beauty?
What is K-beauty?
Why is K-beauty? So when I think about K-beauty, I think it has two major pillars. The first is skincare in the traditional sense. The formulation and texture and daily skin maintenance, prevention, and home care. So actually, Korea has been very influential in that space because Korean consumers are very, educated and very detail-oriented and very consistent. So there's a strong culture of daily skin maintenance here, and that helped Korean skincare become more globally, more visible. But the second pillar, I would say that defines modern K-beauty is actually the clinical procedure, clinical treatment. In Korea, beauty is not only about what you apply on top of the skin, but it is also about how you manage the skin biologically and structurally through procedures, which means lasers can be option and injectables and collagen stimulators, lifting procedures and pigmentation management, and pore and texture work, scar treatment, and body contouring, and increasingly regenerative medicine can be the option we can do. So for me, the K-beauty is not just a product category, it's a treatment culture, and it is a system where skincare and prevention and procedure medicine and maintenance are all connected. So, and the ideal result in Korea is usually not overdone beauty. It is healthy skin, fleshier structure, and natural looking improvement. That is what I think many people outside Korea do not fully understand yet.
Yeah, I think that's true. I think there's some approaches, some countries where it's like, if you've had work done, like you look done. But in Korea, it's like, how do you look like you've had 8 hours of sleep and that you take care of your diet and like you look like you naturally look good? I feel like that's kind of the
but
little
they
bit
do
of the approach.
everything, you know.
Right. Behind the scenes,
Yeah.
it's all done. But you want to appear like you just like wake up with like a nice glow. When do you think that really happened? Where, because I think people have always thought of K-beauty as like the products, like the topicals. When do you think that other pillar, like that second pillar of like the clinical piece has really, because now I think even, you know, within Korea or with outside of Korea, I think people think of it that way. When do you think that other pillar really started to kind of rise to the same level of product?
I've been in this field maybe 10 years ago. And at that time, actually, I did some like skin boosters and also some fillers, but not like this. Actually, these days, we do a lot of lasers. Even it's too overwhelming for me, actually.
Even for, well, I mean, as a consumer, it's definitely overwhelming.
Yeah, I don't know which device is. Even I don't know which device is actually used in these days. So maybe I think maybe it's more visible in after 2010s. Although the roots were already there earlier. So K-beauty become globally popular through products because products travel more easily than procedures.
It's true. It's true.
Maybe sheet mask, essence, or sunscreens can go viral internationally much faster than the treatment.
That whole like 15-step skincare
the,
routine.
Yeah, right.
Everybody
right.
knows about that.
So, but inside Korea, clinic-based beauty culture had already been developing very quickly. Yeah, since maybe 2005, 2010. So consumers here are not only interested in buying creams, so they were also very open to trying lasers, skin boosters, lifting treatments, and preventive procedures at a relatively young age, like younger, like early 20s, like that. So over time, global audience began to notice that the Korean skin they admired was often not just the result of skincare routines. It was also the result of regular in-clinic treatment, careful maintenance, and early intervention. So that is when the perception started shifting, actually. So people began to realize that K-beauty was not only a shelf product. It was an ecosystem that included doctors and devices and treatment protocols and a much more procedural approach to skin health. So I also think Korean culture values, the efficiency.
Oh, very much. Very much.
Yeah. And also the visual refinement.
Yeah.
So if there's just safe and clinically effective way to improve tone, and texture, and contour, many patients here are open to everything. They open to everything. So that willingness accelerated procedure K-beauty in a very strong way, I think.
Yeah, I think so. I mean, the efficiency, like if you've ever been in an elevator in Korea, like somebody better be pushing that door close button. Like it's very like, the bali of it all.
Bali, yeah.
That's so true. How do you, well, I guess Korea's kind of looked at as like this is the place to go for procedures. Like this is kind of the center of that world. How do you think, or like maybe why? Like why Korea?
The first is a very high patient volume, which means a lot experienced doctors gain patterns recognition very quickly. And when you see many cases, you learn faster and refine faster and become much better at selecting the right treatment for the right patient. Right indication means. So the market is very highly competitive, There's so many clinics. In one district, maybe over like 300, 400 clinics in there.
Crazy.
Yeah, it's crazy.
So dense.
I don't even know how actually, in my clinic, actually, when I opened my clinic, I was not sure that the patient gonna be in my clinic. But you know what I mean?
Yeah. You're like, will anybody come?
Yeah. But there's always patient in every clinic.
Always.
Yeah.
You go into any clinic at any time, and there's always people in the waiting room. Like it's never empty unless they're closed. It's crazy.
It's crazy. So maybe the strength is that the clinics cannot stay stagnant. They always try to to compare outcomes and improving the protocols and evaluating new technologies. So maybe there is an environment of rapid refinement.
Like it forces you, because there's so much competition, you have to be seen as, staying on top of it almost.
That's true. And maybe third, the Korean patients are so sophisticated.
Yeah.
Yeah. So many patients understand the difference between the brightness and textures, between lifting and volume, and between immediate effect and long-term tissue change. That level of consumer awareness pushes the field forward.
Oh, absolutely. Yeah. When I have conversations with my Korean friends, like if I said I just got Potenza, and they're like, "Oh, what tip did you use? Did you use the C20 CP25 tip?" And I'm like, "What?" And they're like, "Yeah, did you use that? What topical Juvelog did you use Regeneron?" And then I'll tell my friends from home, and they're like, "What?" They're like, Potenza. Like, what is that? What is that? So it's very different conversations that you kind of have with.
They know everything, everything about the procedure.
Totally.
Yeah.
Everything, right. And I think that also translates a little bit into the consultation. Whereas maybe foreign clients are coming and they think a consultation is going to be 30 minutes. And I'm like, it's weird to be in there for more than 10 minutes, honestly.
That's it. Because, which means it's very hard to consult with the Korean local patient.
They want to tell you?
Yeah. That's why they just choose the procedure and they come to clinic and they don't need consultation.
Right.
Because they already knew about
what they want to do.
Yeah. So that's the one concern that I always think about.
Yeah. Because I think too, you have to have that doctor perspective. Because not everybody, and I think a lot of what happens is, oh, I had a friend who did this, so I'm going to do that. But you don't have the same skin. You don't have the same lifestyle. So it's worth it to spend the 10 minutes to have a consultation, even if it's not that.
That's what I mean.
Yeah.
So, then last, the Korea has strong access to devices and a lot of injectables and treatment innovation. So doctors here often work with the broad range of technologies and can compare them in real practice rather than only in theory. So I would say Korea is a center for procedure skin treatment because it combines high volume, high standards, and fast iteration and a patient base that is very engaged in the process.
Yeah, totally. Because I think one benefit that I see as well is that it's not just, or I guess if I compare it to, kind of in the States where I'm from, you might have one dermatologist in town where it's you have kind of your network of other doctors that you're constantly always sharing information with and your cases and new findings. And it's not just you yourself that has to be competitive. It's I don't know, there's a little bit of the industry is all of the doctors sharing information becomes stronger. There's a little bit of that happens too.
That's very good strength as a Korean doctor.
Absolutely. No, totally. Yeah. Keeps the quality high. I guess talking a little bit about, the difference between, Korean clinic culture, how might the Korean clinic culture differ a little bit from other countries? Either from other, because you have the perspective of other doctors that are coming and sharing their perspective and going to other countries and having, so many foreign patients as well.
I think one major difference is that in Korea, treatment is often approached as a maintenance rather than rescue.
Yeah.
In some countries, patients wait until aging changes become very advanced.
It's a big problem,
and then seek a more dramatic correction.
And they want you to be a miracle worker.
Yeah.
Please take away my 25 years of sun damage.
That's true. Yeah. But in Korea, many patients start earlier. As I said,
sunscreen since forever.
Yeah. And think in terms of maintenance, prevention, and gradual improvement. So that creates a very different treatment culture in here. And another difference is that skin health is central, which means in many markets, the public conversation is very dominated by filler and Botox.
It's like literally surface level.
Yeah, and
Yeah.
all making the different shape.
Right.
But in Korea, those are very important, of course, but they're only a small part of bigger picture. We talk much more about skin tone and pigmentation and pore quality, elasticity, and skin density, inflammation control, and the collagen health. So, but also the combination treatment culture is much more developed here. So we always do the multiple the treatment at one time. So many outcomes are not created by one hero treatment.
Yeah.
They are created by sequencing. So for example, improving redness and then texture and then elasticity and then volume support. That kind of layered approach is very like Korean style.
Yeah. Totally.
Yeah.
That's why you see so many videos of people being like, I did 9 treatments in one day. And
Yeah.
it's like, there's a little bit of a diminishing returns, I think. But I think that's where that kind of comes from. And you'll probably talk a little bit more about this, but you talked to me about treating, like you think about the surface,
Yeah.
the mid-dermis, like that SMAS layer.
Yeah.
And you're like, how am I going to treat all of this to like get you the results you want? And I think it's a really interesting, when you're not used to hearing that, when all you're used to hearing is like Botox filler, and then you start, like people start talking about like soft tissue, you're like, I've never thought about soft tissue in my life.
What the soft tissue is.
Yeah, totally. You're like, why should I even care about that? Which again, I think that's also something that reinforces what you're saying, that like you don't think about it until it's too late. Where you're like, I wish I would have been thinking about my soft tissue when I was in my 30s versus like being 50 and like trying to like catch up, trying to go back.
Yeah, that's what Korean doctors do. We always think about the layer specific approach. So that's why it has to be more personalized and more like doctor led.
Yeah.
But in Korea there's another type of clinics which is high volume.
Yeah.
And yeah, so
AKA the factory clinic.
Yeah, because it's another concept actually. So we should not blame that kind of clinic because it's another concept that also have the pros and cons. Yeah, so patients need to always know the difference, which is not good or bad.
Right. It's what you need.
Yeah.
Yeah. Like you might, like especially for the Korean, like a Korean client, especially who's like, I just know that I want shrink and I want to do it every whatever, and I just want to go and get like the best price for it and then get in and out. But if you're the type of person that's like, I really don't know if I should have like ZERF versus all therapy versus thermage versus like maybe it's not even that, maybe it's like a biostimulator where you really need to sit down and have that conversation, then you need more of a specialized kind of doctor.
That's true.
No, I totally hear that. So that is, I think, one of the biggest things that my clients are, I just don't want to go to a factory clinic. I don't want to feel like I'm like cattle being herded through like a 7-story clinic, and you have to go to one floor for your laser, one floor for your injectable, and like it's just a very disorienting experience. So would you say that those critiques are fair? Like, do you think the critiques of the factory clinics are fair?
Yeah, maybe just some of those are actually fair concerns. Maybe the Korea is very advanced in highly visible aesthetic market, but always the popularity creates distortion. When a market grows quickly, you naturally see more marketing and more trend-driven messaging and sometimes pressure to scale. So that can lead to rushed consultation or less individualized treating planning. So yes, over-treatment can always happen, and factory-style clinic do exist, and maybe the language barrier can affect the safety if the communication is not clear. But I don't think the real question is whether Korea is, as I said, good or bad. The real question is how to recognize a good clinic within a large and complex market. So maybe the key is clarity. So a good clinic should be able to explain why a treatment is recommended and what problem it is solving and what the alternatives are and how it fits into a long-term plan. Maybe that's, yeah.
Yeah. And maybe like why a treatment isn't good for you.
Yeah.
Like if you have your hopes set on a treatment, it's like, that's not for you. No, I think that totally makes sense.
Yeah. So maybe the Korean clinic is not something to like, I mean, the factory style clinic is not something to avoid, but it does require a more thoughtful approach from patients. Actually, they have to always think about what they need.
Totally, and just manage your own expectations.
Yeah,
like you can't go into like a factory style clinic and think it's going to be it's not going to be a relaxing experience, and like your comfort isn't always going to be at the forefront of it. It's going to be a little bit more like efficiency based, that type of thing.
Just experience the Korean things.
Right.
Yeah. Just experience the procedures.
Totally. So even with, kind of that factory clinic being a lot of the clinics here, not a lot. So even with, factory clinics, maybe, some of the doctors that are a little bit more maybe inexperienced that kind of comes along with that. Like, why do you think people are still so drawn to Korea?
Yeah, but actually, when you find the right clinic in Korea, actually the value is very totally real. Because there's a unique combination of high treatment volume in Korea, and clinical experience in innovation and aesthetic literacy. So doctors in Korea here perform this procedure very frequently, and that leads to a more refined understanding of outcomes and patient selection. And the market is also very result driven. So the patient can assess advanced technologies and techniques relatively early rather than the other countries. But I don't think people come just because of hype. They come because when the match is right, the experience can be very precise and very effective. And especially for international patients, I think this is important. Coming to Korea should not be about doing as many treatments as possible in a short time. The real value is in understanding what fits you and building something that can continue after you go back home. Because aesthetic medicine should not end at the airport.
It should not end at the airport. It's one of my favorite things. Like I said, it's one of the favorite things you ever said. No, I think the volume of procedures that doctors do here, like I always thought it was funny when you have like the containers of like the tips of like if like it's the Deserve tip or whatever. I'm like, why don't they just throw them away? But now I'm like, oh, they've done this like millions of times. I'm like, that's what that's showing.
Yeah.
It took me a while to put those two together. What treatment do you think you've done? This is a random question. What treatment do you think you've done the most?
These days?
Just in your whole career.
In whole career.
Yeah.
Maybe the Botox. Yeah, we do. Maybe I think almost everyone do the Botox.
Yeah.
Yeah, over 20s.
Yeah.
Yeah, they do every 3 to 4 months they do Botox, skin Botox, which is baby Botox in terms.
I've gotten it. It hurts though.
Yeah.
But it's
the salmon sperm injection, the
Yep.
Regeneron.
Yep.
Yeah, I think there's over like maybe 90% of the women in Korea they did the Regeneron.
Yeah. Totally.
Yeah.
Even though it hurts. So
Even it
bad.
hurts, it's effective though. And
Yeah.
it's more globally popular in these days.
Yeah, within the last couple of years, I think.
Yeah.
But it launched here in like 2014.
It's been like 12 years since it launched.
Yeah.
Yeah, 12 years.
Yeah. It's crazy.
Yeah, it's been a lot more popular.
Totally.
Even
Do you do skin boosters on yourself?
Yeah, I used to.
That freaks me
But-
out. I don't think I could do it.
But I realized that I hate pain. So actually from last year, I never done the Regeneron and skin Botox. I just did the lasers, the laser toning.
Yeah.
The serum.
Laser toning is so good. Oh, I love Zerf too. Well, that kind of leads us into, okay, well, maybe let's talk about some more like specific treatments. I think there's one on everybody's mind. Let's talk about stem cell. Let's get it out of the way. Let's talk about it. What's the deal with stem cells in Korea? What's going on?
It's very sensitive questions.
Yeah.
Yeah, I think this is actually one of the most misunderstood areas in aesthetic medicine right now. And people hear terms like stem cells, exosomes, or regenerative therapy, IV therapy, and they often blend into a single idea. But medically, these are very different categories. And in Korea especially, those distinctions matter quite a lot. So I think the key point to understand is this. In Korea, it's not just about whether something sounds advanced. It's about what biological category it belongs to and how it is regulated. So if we start with the stem cells, in this strict sense, we are talking about living cells with the capacity for self-renewal and differentiations. It's going to be a little bit more deeper.
Yeah.
For example, cultured mesenchymal stem cells, like we call that in Korean. Can I say in Korean?
Yeah.
중배업 세포, like that, which can actively participate in tissue regeneration and remodeling. These types of therapies are highly controlled, and they are not something that is routinely used in everyday aesthetic practice in clinic. Now, in contrast, what many patients encounter in clinic is something quite different, actually. Not that kind of things. For example, treatment derived from patient's own blood, such as centrifuged fractions like Buffy coat, maybe it can be the PRP or PRF, contain a mixture of platelets, white blood cells, and a small population of circulating progenitor cells, which can be some signal for regeneration and rejuvenation. These progenitor cells are not the same as cultured stem cells, the mesenchymal stem cells. So they have limited differentiation capacity, but they can contribute to repair processes and signaling, as I said. So one concept that is often discussed here is the homing effect. You heard of the homing effect?
I haven't heard of this, no.
No, homing effect. So this is where circulating cells or signaling factors tend to migrate toward areas of inflammation or tissue damage. That is the concept of the homing effect.
Got it.
So when you do some IV therapy with the Buffy coat, we think that some progenitor cells, maybe the stem cells, can go through your blood to some inflammatory regions, and that can fix
The inflammation.
those inflammations.
Interesting.
That's the concept. Actually, it's more evidenced.
Okay.
now.
That was going to be my next question is is it still just like a idea or is
Yeah.
are we seeing it in
So maybe when these blood-derived components are used, whether intravenously or in the skin as a skin booster, the goal is not to directly replace tissue, but to support the biological environment for healing and angiogenesis and recovery. So this is fundamentally different from what cultured mesenchymal stem cells are designed to do, actually. So yeah, you know what I mean. So maybe I think the important distinction is this: not everything that is described as stem cell operates at the same biological levels. So some treatments are based on signaling and support, like growth factors, inflammatory modulation, and progenitor cell activity. Others involve actual stem cells with broader regenerative potential, which are much more tightly regulated. So, and in Korea, those distinctions are taken quite seriously. So rather than focusing on the terminology, like stem cells, I think it's much more important to understand what the treatment actually contains.
Yeah.
What it biologically capable of doing. So, and what role is realistically plays in patient care. So,
Got it. So it's less about following like stem cells the latest and greatest and more like understanding what we know about it right now, I guess, maybe.
Yeah.
It's kind of thinking stem cell treatments are not a miracle treatment, but like doing way more than, like, are people coming saying like, can I have a stem cell IV because I'm not sleeping well or something? Or
That can be.
yeah.
Yeah.
Okay.
It can be very helpful. But, it's kind of the very broad spectrum therapy.
Yeah.
So some patients can feel the effect of the stem cell IV therapy, but some people not.
Yeah.
Will not. So it's the possibility. It's a matter of possibility.
Got it. Got it. So it wouldn't be like, I want a stem cell therapy to get rid of my wrinkles. It's like, that's just not the way to think about it, right? It's like you got to think about it more of a...
More internally
Right.
wellness things.
Totally. I think we've gone from like slow aging
Yeah.
to no aging to now people are like, let's reverse it. They're like, we're going to like turn back the clock is now the what people are focusing on.
I think that's why the K-beauties changes to the K-wellness in these days.
Yeah, wellness is a big one. Wellness is like a whole nother situation.
Yeah, I saw some like the boutique travel company in abroad. They are making some programs in Korea about the K-wellness.
Yeah, like K-wellness retreats and yeah, totally. I think it's it's going to be maybe that'll be the next third pillar of K-beauty.
Another market maybe.
Another market, yeah, exactly. Totally.
Yeah.
Do you think, because I feel like, kind of in like the regenerative track, not too long ago, it was all about like exosomes.
Yeah, exosomes.
And I don't really hear people talking about exosomes anymore. Like, do you think stem cells are going to be the new exosomes? Do you think, like, are they going to just kind of go away once something else comes? Like, or do you think stem cells are here to stay?
Yeah. I don't think that those kind of regenerative medicine itself is going anywhere. But I do think the terminology and how it's interpreted in the market can change very quickly. So, as you said, the exosomes. Exosomes became very popular because they were relatively easy to communicate. The sounded advanced, regenerative, and scientifically appealing. But from a biological standpoint, exosomes are extracellular vesicles, which is not actually the stem cells. It's only the particles itself. So it's kind of the proteins, lipid, and RNA between cells. So that's why it became more popular maybe last 5 years ago. But actually, nowadays, it's getting more, I think it's...
Going to come back again?
No. It's just in my opinion.
Hard pass. Absolutely not.
It's getting a lot more like there's studies that are going on.
More
But
and more.
because the term exosome is like so fancy, right?
It's very fancy.
It's
because you don't understand it. It must be. It must work really well.
Yeah, but I'm not sure because it's not that evidence yet. But maybe some studies keep going.
Yeah.
Studies, but I'm not sure about that.
Yeah.
Just in my opinion.
Yeah. I really liked exosomes for a while. Like, I love a good Potenza treatment. So I will mention a lot. But I always had like topical exosomes until I had topical like Juvalook. And then I was like, oh, okay, this makes sense.
So that's why the exosome is not actually allowed in Korea for injections.
Right.
It's only for the topicals after the microneedling or like the non-ablative fractional lasers. Yeah, maybe it's not evidence. It's not approved as the injectable, the medical device. It's only for the cosmetic things.
Right. And then a lot of cosmetics, it's like rose. It's not like human exosomes. It's like plant-based exosomes, which I don't really know what that
So only
means,
approved,
but-
only approved exosome in here is the autologous exosomes here. From our blood.
Yeah. Why aren't, this is another tangent, why aren't stem cell treatments called like exosome treatments? Or like why wouldn't they call them like a growth, like why do you think it's stem cell? Like why not growth factor or?
It's actually I think the root is the same.
Oh.
The reason we do the stem cell is actually the stem cell have a lot of potential for the signaling to generate for the regeneration. But as I said, the exosome contains like RNA and proteins and some like the lipids, which can be, it's not directly generate tissue, but to modulate cellular behavior and local microenvironment. That's why people are confused with the stem cell and the exosomes.
Yeah.
Yeah. But, you know, the exosomes are very like...
They're fancy.
Yeah, fancy.
They're fancy.
That's why we do a lot of the exosomes last 5 years.
So you think there's a clear difference that like exosomes, or like as maybe like what had happened to exosomes, stem cells you think are staying, exosomes are maybe still kind of fall by the wayside.
Because you know the exosome, they contain some like RNA and DNA fragments. And we don't know that kind of fragment, the components do afterwards.
Oh.
That's why it has to be more studied. But you know the stem cell, especially non-cultured, the peripheral, the stem cell, is totally safe. As I said, homing effect. We are just expecting the homing effect. So it's totally safe, and we know it's very predictable. That's why it's more safe.
Right.
Even it has no effect, no result, but we can do.
You can predict that it might not have a result.
It's not gonna harm our.
Right, which is safer than not knowing what something can do. Oh, that makes sense. I think that makes a lot of sense. Maybe if we, stem cells, exosomes, those are all like really kind of exciting. I think another, and in the line of like regenerative, medicine, I think biostimulators is a big one. Are there any innovations in like biostimulators that are happening now? And I guess maybe a second part of that question is like the ECM boosters. Yeah. Like, I feel like there's more and more coming out all the time. Like there was kind of one ECM, and now it's become, in my mind, from the consumer perspective, it looks like, I feel personally, I don't really hear a lot about stem cell anymore. It's kind of now this like ECM situation. Yeah. So what are your thoughts?
Yeah. This is an area that I find very exciting these days, because biostimulators are moving the field away from purely space occupying the volume and toward biologic tissue remodeling. That's why I prefer the biostimulators a lot. And what interests me most is not just whether a product can stimulate collagen, because many products claim that actually.
So, a lot.
Yeah.
Topicals, everything.
So what matters is how predictably it does so, and how well it integrates into tissue, and how controllable the inflammatory response is, and how long the result lasts, and how safely it can be used in different planes and indications. So that is where formulation becomes important. So particle design and carrier behavior and dilution strategy, placement depth, and tissue response all matter. So good biostimulator is not just strong; it has to be predictable. So that's why the ECM related products are so getting more popular in these days, and more. And I'm really interested in that kind of product in these days. So that kind of product brings a different regenerative concept into the conversation, actually. So they may offer benefits in tissue quality and matrix support, but the trade-off is that the evidence-based consistency and the predictability, as I said, may vary depending on the product and the indications. So the Ritual and the Jova cell in here is getting more popular. So a lot of people do that, and even the patient from the abroad, they come to Korea and ask about what is the Ritual, and they want to do the Ritual. Even the mention about some side effects of the Ritual and Jova cells.
With every treatment, there's risks. Yeah.
There's also, even if it's with Botox, there's always a risk. Yeah. So, I'm really excited about that kind of ECM booster because it's so trendy here. But not yet. We don't know we didn't have any the long-term follow-up yet.
Yeah. Still learning.
Yeah, still learning, and we have to see more years to follow up.
Yeah.
Yeah.
What is your patient base? What is their reaction? Because like I have people that ask me, they're like, "Are you really taking the flesh of other humans and injecting it into people's faces?" And I'm like, "Not exactly, but this is like, do you? What do you find your patient base? Are they like, yeah, let's do it, let's try it, or are they like, no, that's weird, I'm not going there? Like,
Actually, the material itself is very I mean, we already use the material as in the plastic surgery field.
Yeah.
Yeah, that's why people are more like open to. But it's from the cadaver.
Yeah.
Yeah, it's from the cadaver, and it has to be very like certified process.
Yeah.
But people always have some question mark. It's
Curious.
Yeah, curious.
Yeah.
Where is it really from?
Right.
Yeah, that's why some people are very like cautious
Yep.
about the procedure, but mostly they just want to do it because they know the effect.
Yeah.
They already searched about the result. So yeah.
The fountain of youth. Yeah. Yeah. Which, I mean, to be an ECM booster, like anything would have to come from like a certified tissue bank, right? Like there's like different processes that they put together. It's not just like
That's
people
true.
are stealing it or something. Like
There's also certified
places that it
places.
can come from.
Maybe in the States.
Yeah. I think I've asked you this before too about, because like Regeneron, you get like a certificate that's like, this is a certified Regeneron product. Do you think we'll see that with ECM boosters?
We are already doing that.
Oh, really?
Yeah, we already do some certified.
Where you like scan it.
We have
and it
to
comes-
make some like papers.
Got it.
Yeah.
Yeah. Because I feel like that puts people at ease, I think. It puts me at ease. Where
But
I'm
consumers don't know because they're not asking about.
that's kind of crazy to me. Like for me, I want to know. But also too, I think, and maybe I'd like to know your perspective on this. Like the country that I come from, like is wild things are happening back there. So like in the States, there's regulation. It differs state to state. But I think you asked me one time, like, why do people care if you like open things in front of them or like, and you're like, why do people want to do that? And it's because like in the States, people are like injecting cement into people and like all the like weird stuff is happening. They're opening up med spas in their backyards and like things are going crazy. So if you find an American patient that's a little bit more cautious, it's just because the world we are coming from is wild. We need a little bit more.
I totally understand about that.
Yeah, we need a little bit more. Just like we trust you, we do, but we just have that in the back of our heads. But well, I think like talking about ECM, and that's along the lines of, a big part of anti-aging is just like the collagen building. How do you approach long-term collagen? Like you have to, and it makes sense for people to have a long-term collagen strategy. Like if you're wanting to be taking care of your skin, interested in anti-aging, like you should have a longer term collagen strategy instead of just being like, here's the newest thing, let me try it. Here's the newest thing, let me try it. Like what is your approach to sort of longer term?
Yeah, for me, the long-term collagen strategy begins with the understanding that the skin and soft tissue age in layers. So you cannot treat every patient as if one treatment can solve everything. Some patients need better epidermal quality, some need dermal remodeling, some need deeper support, some need lifting, some need volume control, and many need a combination of all three. So that is why I think in layers. So first I consider the surface, the tone and pigmentation, inflammation and barrier health, and texture. Then I consider the mid layer, like dermal collagen, elasticity, pores, and skin density. Then I consider the structure support, like ligament, fat compartments, facial support, and how the face is aging dimensionally. So this is also the philosophy behind the face mask.
Yeah.
Which is the patent, the rejuvenation program.
Yeah, which is really cool. It's really cool that you have like a patented like facial rejuvenation program. That's cool.
Yeah, it's cool. Yeah,
It is cool.
Yeah, the word face mask is really cool.
Yeah.
I just combine the word the face is mask.
Yeah.
Yeah, it's
Well,
cool.
that is cool, but also like having like a patented approach is also a cool thing. So yeah.
So actually, that program is not the chasing one hero procedure. So it's about the sequencing technologies and injectables in a way that supports natural and progressive rejuvenation. So the skin health is the priority always, because when the skin is healthier, most other outcomes improve as well.
Totally.
Yeah.
So the face mask program it's not like I'm going to do like a biostimulator, this, pigmentation laser in this. It's like still very customizable.
Yeah, customizable. And also a lot personalized programs. So every patient have another type of program that we have to approach.
Yeah,
differently.
totally.
So I often tell patients that collagen building is not an event. It is a kind of strategies. If you approach it in that way, results become more natural, can be more natural and more stable and even more elegant over time, actually. So
Yeah, I've seen some of your before and afters, and they're pretty impressive.
actually,
Yeah, they're very good. Absolutely. Well, I guess speaking of lifting, I feel like, and maybe it's just because they've been around forever, but I still think sometimes in people's minds, up until like very recently with like the new Zerf launch, but I think, so many people think like the only thing of all therapy are like thermage.
Yeah.
Like what do you think that is?
and we call that also much.
Osmage, yep.
So actually, because those names are became categories in people's mind, that happens often in aesthetics. The device becomes famous, and then patient begin to using the brand name as shorthand.
It's like the Google.
Yeah.
It's like, or like the Kleenex. Got it.
Yeah, kind of that. So they say OSRP when they really mean HIFU, and or Thermage when they really means RF tightening.
Yeah.
Yeah, but today the field is too much broader. So many devices we
So
have.
many devices.
So there's so many different energy platforms with distinct mechanisms, depth, indications, and comfort profiles, and treatment goals. So HIFU and monopolar RF, like Seraph and Thermage, and fractional non-ablative lasers, and vascular and pigment devices, and RF microneedling, which you did,
Which I love. It's one of my favorite.
and also the microwave technologies.
Yeah, that's coming up hot, I think.
Yeah. Microwave, it's also good. It's also getting more popular these days. So actually, those are all different tools. So, and even within that, people would think of it as a single category. There's a lot of variations.
Yeah.
For example, in RF-based treatment, it's not just so much anymore. As I said, Seraph, they're new monopolar RF. Seraph, just last year's, Seraph was launched last year, right? It's very brand new.
Yeah.
And also various Korean developed RF devices like volumers, and density. Yeah.
Yep.
That allows more flexibility in parameters and treatment approaches. And similarly, in ultrasound-based lifting, devices like SoftWave, it's very similar to OSRP, but very different mechanisms we have. And also, which can change both treatment experiences and the indications. Gotta be more different.
Right. Yeah.
And also, there's a new concept like the multi-energy or hybrid system, like titanium.
Oh yeah.
Yeah.
Titanium is so interesting to me.
Yeah, it's very. I thought actually, when I first saw the titanium, I just like think that
You dismissed it.
Yeah.
You're like, nah.
yeah, but yeah, it became so popular these days.
Yeah.
So I sometimes regret that I didn't buy the titanium because a lot of people come to ask me about the titanium because I know that it has very instant effect and it's good for the pigmentations and more.
It reduces the hair
Yeah.
if you have darker hair. Yeah.
So yeah, it's been more like trendy in these days in Korea.
And for anybody who doesn't know what a titanium laser, it's a triple diode laser, right? And it was initially developed for hair
Yeah, for hair
removal.
removal.
And now in Korea, it's been kind of reappropriated as like a more surface level, kind of like tightening and brightening. And you can layer it too with like a deeper, like you could do like titanium plus
Other things are
all
like
therapy
RF.
or, so that's crazy. Interesting.
So that's why a lot of the combination therapy with the titanium and other lasers or other like skin booster can be.
Do you think titanium would be okay by itself? Or do you think you kind of need that other, well, I guess, and that's a hard question too, because everybody's different and everybody, but I think maybe if it's possible to answer it generally, is titanium on its own, like,
Yeah, it is. Yeah,
Yeah.
it is actually very good good lasers to make some good result. Yeah, but you know, someone who did just only the titanium, it lasts a little bit more, like shorter.
yeah,
That's why we always combine it with the some like deeper layered
yeah,
the laser like some RF, the monopole RF or HIFU to have more like long term
Yeah.
effect.
because
But-
then you get, or you go
Yeah.
ahead. I was going to say, because then you get the, like, one of the downfalls of like all therapy specifically is that it just takes so long to see results. So if you're doing that plus a titanium, then you're getting like an instant, like you're getting a little bit of like from a patient satisfaction. Like I'm like, okay, this is what I paid for. You know, like I paid for something and it made a difference versus like just doing all therapy. We were like, maybe it worked. Hopefully we'll see in a couple months. So I think,
Yeah, so that's why, the actually those are all like branded, right? The branding things. So the challenge is that public understanding is usually actually brand based
yeah.
always. But while good medical decision making should be more like mechanism based, I think.
So like mechanism is like, so you're saying like, do we do it's not like, do we do all therapy? It's like, do we do HIFU?
Yeah.
Do we do RF?
That's exactly right.
Got it.
So the question should not be what is the most famous device.
Right.
It should be like what tissue are we targeting and what problem are we trying to solve
Yeah.
and what energy profile best fits that patient. So that is why consultation always matters. And the patient may come in asking for one specific device. But after proper assessment, like a completely different category or a combination of treatments may actually be more like appropriate
Yeah.
always. Yeah.
Totally. And it's, at least from what I'm seeing on the consumer side of things is there's a lot of like, historically, I think it was like all therapy versus thermage. And now it's kind of like, do I do Zerf or Softwave? And I'm like, why are we even comparing these? Like it's HIFU and radio frequency. But I think it's just like, these are, like you're saying, it's the brand names that people are understanding and attaching to and not knowing. Like in my mind, I would say like, would I do, or I guess the question that I would ask is like, should I do thermage, Zerf, or like density? Like that would be my question because I'm like, those are all like radio frequency. But again, if it is a radio frequency, that is the answer for me, But I think, to your point, I think a lot of times we spend too much time as consumers worrying about having too much of an idea before we're going in to the
Too
consultation.
much ideas.
Which it's nice to know, like, because it does kind of get confusing when you're like in the consultation and it just turns into like this word salad of like all therapy. Like it's still the brand names where you're like, I don't know what all this. Like I think it is so good for people to know generally what things do, but trust the doctor. Like trust.
But if some patient know too much, we always have to debate. We always have to fight
Yeah.
which procedure we have to do.
I promise I'm not that patient. I'm not fighting, but I'm asking educated questions. Whereas I'm like, oh, do you have that CB25 tip for that potenza? Do you have it? 4 cc's, why not 5 cc's? Yeah. Do you have that often where you're like debating?
Always.
Always.
Yeah, always.
Well, because I feel like a
Especially-
Korean patient base.
Korean patient. Actually, I only have the local Korean patient who is come by the word of mouth. So
like-
that's why actually I don't fight with the Korean local patient. But maybe some patient from the abroad, they always ask me about what the lasers we
That
have.
makes sense.
Yeah.
And that also comes from just different, not only like aesthetics, but just a different medical system where you have to sort of protect yourself more. I think of maybe a little bit like foreign, in the US, you always are like, you talk to a doctor and then it's always very common to get a second opinion.
Yeah.
So-
That's why when some patient who want to make a reservation in our clinic, before coming to clinic, I always mention that we are not kind of the treatment shopping clinic.
Yeah.
You always have to consult with me, with a doctor, and you have to choose what doctors recommend.
Right.
Yeah.
You can't just go in and select whatever it is. How do you select which devices you're going to have in your, like, there's so many different,
Yeah, so many different.
and like from a business perspective, like these machines are expensive. The maintenance is expensive. So you can't just, from the consumer side, you can't just expect every clinic to have every device because it just, from a business perspective, doesn't make sense. So like, how do you choose which devices you're going to have, which you're going to maybe keep? Because I do know like sometimes doctors like get a device and they're like, and then they get rid of it. Like how do you, like, what goes into that decision making for you?
Yeah, maybe several things. Several things that I have to consider. The first, maybe the evidence and clinical constancy. I want to know whether the device performs well, not just in ideal cases, but in daily practices across many tissue height types and patient profiles. And the second, maybe the safety, always. So in aesthetic medicine, a treatment is not truly good if it is only effective in narrow window and becomes unpredictable outside it. So always the safety margin is the matter. And maybe third, the controllability, the easy to use. I like technologies that allow meaningful customization, and that the more precisely I can adjust treatment to patient anatomy and tissue condition, the better. And maybe the last, the reliability and support from the manufacturer. Maybe the issue. The device is not only a machine, actually.
Yeah.
Yeah, it is also a system of training and the maintenance and the clinical partnership that matters a lot as a doctor. Actually.
Yeah. No, totally. Are there any, I always feel like, speaking of titanium, I always feel like that looks like a comfortable treatment to do. Like just that little gun.
Titanium?
Yeah, oh, it's not a gun, but yeah, like that little thing. I don't know. Like, are there any treatments that come to mind that are like really comfortable to do? Like they've put a lot of thought into like the ergonomics of like holding the device and like, if a treatment takes 45 minutes, like you have to
Maybe
take into
some
account.
bipolar RF lasers. It's very easy to handle as a procedure because it does not make that kind of side effect, severe side effect.
Yeah.
It's very easy to the
like
procedure,
handle
and the procedures, and maybe the serve. Because as I said, the safety is always the matter.
Yeah.
And serve actually, which has the good cooling system. And we get the serve before. Yeah,
Yeah, I love surf.
it's so
It's
actually
very
it's no
comfortable.
pain. Yeah, very comfortable
Yeah.
and no pain.
Yeah.
Even I raised the treatment level. You cannot even feel the pain, just
Yeah.
the warmness, right?
Right.
So that's why I can do more comfortably when I do the procedure,
Right.
without any thinking about the side effect
Right.
of the burn like that.
Yeah, and the pain level.
Yeah,
Yeah, because if the patient's comfortable, like it's just easier. Like I don't know. I feel like skin boosters. I'm always like, don't
always.
move. I'm like, don't jump, don't move. I'm
You
like,
always
just be
need the
still.
squeeze balls and
Yeah, exactly. So, I mean, we've been talking about a lot about like energy-based treatments, and I think that's a big reason that people do come to Korea's for the variance in the diversity of the energy-based treatments, but also like you're saying, like the doctor expertise, like doctors here are doing these energy-based treatments like all day, every day. What do you, and we talked a little bit about patients fighting you and knowing, so what do you think people should know before getting energy-based treatments?
Maybe they should know about the goal of the treatment always, and the realistic timeline of the result, and the limits of what energy can do. So many people walk in asking for lifting, but lifting can mean very different things.
Yeah.
Sometimes the lifting can be the tightening,
Right.
and better jawline, like definition, or sometimes reduced heaviness and less elasticity around the eyes. And those are not actually are always solved by the same device. So patients should also know that more energy is not always better. So stronger is not always the smarter. And over-treatment can damage tissue and create unwanted fat loss, or simply produce an efficient result. So good treatment is always targeted treatment. So what patients should decide before the appointment is their priorities. Lifting, the pore improvement, the pigmentation, redness, skin texture, the recovery time, maybe the budget.
Yeah.
And
That's true.
long-term maintenance. So what they should leave to the doctor is technical selection. Which device, what depths, and how many shots or passes, and whether combination treatment is needed. So always that division is important. So patient brings the goal, and the doctor should brings always the method. So we should tell them the method, not the
Trust the one that went to med school and has the experience. No, I think that totally makes sense. And I always, like, people always ask me, like, what treatment should I do? And I'm like, how am I supposed to tell you? I was like, what you should do is like, or people talk about research, like, oh, how can I do my own research? And I'm like, go in the bathroom and look in the mirror. I'm like, you should start in the mirror. Like, it doesn't start on TikTok. It doesn't start on like ChatGPT. Like, you should start by like looking at your face and say like, what bothers me? What doesn't bother me? Like, and always be kind to yourself. Don't be too hard on yourself when you're doing that as well. Okay. So at the end of the day, is it the ultimate goal? Sounds like it's, if you want to be slow aging, no aging, reverse aging, however we want to call it, it sounds like the goal is, skin health, skin density, and like collagen building. Is that kind of, the building blocks of good
absolutely.
skin?
Yeah. There's the foundation. So also the aesthetic includes contour and proportion and beauty standards. But if you focus only on shape and like ignore tissue quality, the result becomes more like less convincing over time. So the skin health, skin density, elasticity, the collagen integrity, and controlled inflammation are what makes a face look more fresh rather than simply just treated. So that is why I believe good aesthetic medicine should move away from a correction-only method and toward the tissue health mindset. When you build healthier tissue, you often get better texture, better glow, and better elasticity, and better support at the same time. So maybe the skin health is not the secondary issue; it's the core strategy.
It's the actual what you should be focusing on. I'm going to be thinking about my soft tissue probably now for the rest of my life, for now until forever. speaking of like contouring, and skin density, skin laxity, as GLP-1s become more and more a part of, it seems like everybody's daily life. What should people know, about, either body contouring or just like skin health in general when it comes to GLP-1s? Like, what should people keep in mind?
Yeah, even I used the GLP-1 last year, and I got maybe the 10 kilogram weight loss.
Wow, good for you.
That's why I got some sag skin these days.
You found?
Yeah.
Oh, no.
And also the body.
Oh, yeah.
Because I hate exercise.
I'm with you. I don't love it.
Actually, the conversation is changing very quickly.
Yeah.
So as you said, as more people use GLP-1 medication and lose weight, they're not only noticing facial changes, they are also paying more attention to the skin elasticity and contour irregularities, cellulite on their body, and tissue deflation, and the difference between being smaller and actual looking toned.
Mm-hmm.
So the body should not be treated exactly like this face. So, as you said, we use the GLP-1 these days, and firstly, the launched, they say it's a game changer in this market, in this obesity market, actually. But it gives a lot of the issues on the skincare, the skin health.
Yeah.
So, it's actually the game changer, but in that case, we need a lot more to do for our skin.
Yeah.
To improve skin quality.
Right.
So that's why the GLP-1 gives a lot more opportunity in this market.
Yeah.
Yeah. You can develop more product.
Right.
Yeah.
Yeah.
Which can make up that.
Right. I think and maybe we'll see this, maybe we will not. I think there's going to be maybe more, facial devices that are being maybe developed to be using on the bodies, different protocols for the bodies, or even, different formulations like formulations that are meant specifically, for the body, whether it's like biostimulators or things like that. I think almost 40% of my clients are looking for face treatments, but also for body treatments.
Yeah.
And some are just looking for body treatments. And a lot of it is tied to GLP-1s. So I think that's going to be an interesting
That's
space
why
too.
the biostimulators are more coming.
Right. Because you can't just
Coming issues.
fill all that up with fillers and see
because
what
the filler is just the fillers, but biostimulators can stimulate your own collagen.
Yeah.
So people are actually more concerned about their own collagen.
Mm-hmm.
So they're more positive to their collagen,
Right.
not the fillers.
Right.
Yeah,
Yeah.
that's
Fillers
why.
are.
Sometimes fillers are good.
Yeah.
Yeah, but
I think it's becoming less and less. We're definitely seeing less under eye fillers these days. Yeah, but you can do all kinds of crazy things with fillers. Maybe on that note, let's talk about some controversial. Not some controversial. I want to talk about threads. Because after being in Korea, threads to me are threads. I would consider threads kind of in the same vein as Botox. Whereas in other countries, other geographies, it's threads are very divisive.
Yeah.
It's never do threads. The complications can be crazy. Which, why do you think that is? Why do you think outside Korea, those thread treatments are so kind of viewed as crazy, maybe? Or why is it so divisive? What's your take?
Yeah, I agree with you. There's some divisive. Because for many people outside Korea, the perception of thread lifting was shaped by older generation of products, inconsistent technique and poor indications. I have so much to talk about the thread actually.
Yeah.
But in my view, the problem is not thread as a category. The problem is oversimplification actually. Threads are not magic and they're not appropriate for every patient. So you have to select the patient always. And the problem, but when they are selected well and performed by an experienced practitioner with a clear understanding of anatomy, they cannot be extremely valuable. They can be extremely valuable, actually.
Yeah.
So, and to be fair, this is not just a debate among patients. Even among doctors, deadlifting is still quite controversial. There are definitely strong opinion on both sides, actually.
In Korea or like outside?
Globally.
Globally,
Yeah. So that said, I think there is one point that is often overlooked. For patients who are not ready for the surgery or who simply do not want surgery but still want a more meaningful lifting effect, thread lifting is often the only realistic option we have. We have. That's why in Korea we do a lot of thread lifting in Korea. So it occupies a very specific space between non-invasive treatment and surgery. So I also think it is important to compare risk honestly.
Yeah.
Some people speak about thread as if they are uniquely dangerous. But every aesthetic modality has a risk. Even fillers have a risk, energy-based devices have a risk, and surgery has risk. The question is not whether risk exists. Actually, the question is how predictable the treatment is in trained hand and whether the indication is incorrect.
Yeah.
So maybe there are many stories about the complications of thread. Globally,
Yeah. Maybe.
Some migration of the thread and some inflammation due to the thread.
Here's what I hear coming out of the U.S. is that threads can be pulled too tight, and then they can the puckering that can happen on the surface of the skin, dimples, or that you could get hit in the face and they can snap. And it's I don't know if that's I feel like those are kind of edge cases where the way that you explained it to me was if we inject filler, it's just in there and we can't, it's hard. I mean, we can dissolve it, whatever, but we also maybe don't know as much as we used to know about filler. But you're if a thread goes in and it's not good, we take it out.
Yeah, we can just take it out.
We take it out.
If there's just dimple right after the procedure, we can just fix it right away.
Right.
So it's not gonna be that problem. But sometimes always the infection can be happen even with the fillers or even skin boosters.
Yeah. Botox.
Actually, that's the matter of the hygiene.
Yeah.
It's a matter of the sterilization. So it's actually not because of the product itself, actually. So, so that's why we have to recognize that complication not unique to the thread.
Yeah.
That exists across all aesthetic treatment,
right.
actually.
So what do you think are some misconceptions from early generation threads that just no longer apply today?
A major misconception is that thread lifting is still based on the same materials, techniques, and goals that define much earlier generation. So thread technology has evolved significantly. The materials are much better understood. Absorbable options are well established now, and many threads today are not just about mechanical lifting. They also play a role in collagen stimulation and long-term tissue support. And another misconception is that thread lifting is only a desperate alternative for people avoiding surgery.
Yeah, I think that's such an unfair.
That's very true.
Yeah.
That is now how I see it. In many cases, threads are best used as part of broader anti-aging strategy, especially in patients who need repositioning, structure support, and or improvement in tissue quality before they would ever consider surgery. So, and I think another important misunderstanding is around result.
Yeah.
The people often expect thread lifting to look dramatic, immediately. So, but in reality, the best outcomes are usually more refined and naturally elegant.
Yeah.
So there is an immediate lifting effect also, but a large part of the value comes from what happens over time. So the tissue responses, collagen remodeling and structural support are just as important as the initial lift. So I would say modern threads should be understood as a category that has matured significantly, not only in materials techniques, but also in how we think about their role in long-term aging.
What factors into speaking? Because the more that I was trying to learn about threads, the more I couldn't believe how diverse threads are. Like you're saying, like in the material, even like the shape of the threads, like the little barbs, or is it cones, or is it, whatever it is. What type of threads do you use at Lebelle?
Actually, as you said, so many type of thread we have in Korea. So actually, different types of thread are useful for different purposes. Some are better when I want a stronger lifting support. Some are better when the goal is tissue integration and collagen support. And some are more appropriate in delicate areas, while others are better suitable for stronger vectors. But if I simplify my criteria, I look for three things actually. First, immediate effectiveness. There needs to be clear, visible lifting effect at right after the treatment. And second, durability. The lifting results should not disappear too quickly. So the structural integrity and longevity of the materials are very important. And third, usability and consistency. So the thread should behave predictably, be easy to control, and allow precise placement. Of course, the material itself is very important. So today, many of the threads I prefer are based on biostimulatory, the polymers. So these materials don't just provide mechanical lifting. They also support collagen stimulation and tissue remodeling over time. Like after, so I always say, if you do the thread lift, it can continue. It can last for like over 2 years because it can still stimulate the collagen.
Right.
Yeah.
No, totally.
So you're not only lifting the tissue, but also we can also improve the tissue quality itself. So always that combination, immediate lift plus long-term biological effect, is what I value the most always. And finally, I always choose based on the philosophy. I'm not interested in adding products just because they're new. I choose thread that help me achieve natural, more stable, and progressively result for my patient.
Yeah, and there's so many things you can do with threads, and I feel like there's a lot more people that have had threads done that you would never know, and they don't really talk about it. Like, I think historically, when people think threads, it's just like the cheek threads, but there's so many different places, like the eyebrow lifts, and everyone's like, did you get like an upper bluff? And it's like, maybe it's just thread, you don't know. Like, they're so versatile.
Even you can use thread for the body.
Yeah.
Yeah.
I've heard of this.
Yeah, for the buttock area.
Yep, like the buttocks lift.
And also we use small thread for the tightening for the abdomen area.
Yeah. What was I going to say? But also, too, I think that it's really exciting, too, as somebody who I enjoy the effect of a skin booster, but getting the manual injections like every month is a little insane. So if you can have something that's going to improve your collagen, that's like, placed once, and then you get that benefit, and you don't have to have the injections, that's really exciting to me.
Yeah, that's actually it's not a new one. Actually, globally.
Globally, it's new.
It's not. It's globally. It has been very long.
Oh,
time.
really?
Yeah,
Oh,
but
it's
it's new in
curve.
Korea.
Oh.
It's very new in Korea. Can I mention the brand name?
I think it's up to you. You know more about that.
Maybe the thread called Aptos.
I've been seeing a lot of of like Aptos is doing a lot of like really innovative stuff with
that contains also the biopolymers and also the HA.
Yeah, the hyaluronic acid.
Yeah, the sustained release of HA can make your skin more like moisturized.
Right. Like if you have just chronic dry skin.
Yeah.
Or it was like in the wintertime.
Theoretically, it's very ideal.
Yeah.
But yeah.
It's still new.
It's still
it goes in
new.
that bucket of still new. We're still learning, but it's
We have
still
to
very
see
exciting.
the result.
Yeah. I think that could be so cool. Like instead of like trying to, as like my skin, I have dry skin, like trying to just constantly fight it with topicals and like making sure you're drinking enough water and all of that stuff. If you could do threads that are continuously hydrating your skin, like that is fascinating to me.
Yeah, that is.
I
It's
mean,
actually.
Yeah, like that's always exciting and cool.
But it's too much high cost.
Yeah.
It's almost compared to the surgery. I think that's a big hurdle.
That's a
Yeah.
pretty big hurdle. That's a pretty big hurdle.
But yeah, someone who did the Aptos, she said that it deserved it.
Yeah. Wow. And the more, I mean, maybe there'll be more competition, more advancements, bring it down. So is that, I mean, that kind of talks about one of the things that you're excited about. Are there any other like sort of advancements in the threads that have you excited?
Actually, in the past, actually, the thread were mainly about the physical pulling tissue. But now the more focus on the shifting toward the combining structural support with biological response. As I said, the stimulatory effect of the thread and the HA effect of the thread. So I think always the materials that have biostimulatory properties are particularly exciting these days, and maybe there's gonna be more like the thread which contains another type of skin booster.
ECM. ECM threads.
Maybe ECM thread can be.
I mean,
and maybe the PDR instead.
Yeah. People would do Regeneron threads.
Yeah.
They would
maybe
do
that can be one of the idea that the company can develop.
All those pharmaceutical companies get on it.
So maybe the new content always need to be evaluated carefully, but it's always in.
I think this is I think we're going to see more about threads coming in the next couple years. I really do. And I really think more people are going to be coming to Korea for threads because of you said like what's available. The doctors are used to doing it a lot. And the predictability is, especially when you're traveling too, you want something that's going to be a predictable treatment. You don't want to be a little bit too risky there. So, what else? Like, so, looking ahead, Korea has they've built this reputation for, rapid development, but still maintaining a level of, kind of the highest quality and innovation. Like, what do you think is next for K-Beauty?
I think K-Beauty will continue moving in two directions at the same time. One direction is greater sophistication in regenerative and collagen-centered medicine. We'll see more like focus on tissue quality, the biologic aging, recovery, inflammation control, and long-term structural support, rather than only quick aesthetic correction. And the other direction is greater segmentation. So in the past, many treatments were marketed very broadly, but in the future, I think treatment will become more personalized by anatomy, age, skin condition, and even lifestyles. So the best clinic will not just offer many treatments. They will become better at choosing less, but choosing more like precisely. So what I hope remains constant is Korean emphasis on refinement and iteration. So Korea is very strong at improving things quickly, but as the global spotlight grows, quality controls and honest education will become even more important. So innovation is valuable only if it is guided by responsibility. So, and another thing is that I also think we are already seeing a shift toward that could be called care wellness, as I mentioned before. So it's not just something for the future; it's already happening now. So there's are more treatment now that are focused on recovery, as I said, inflammatory control, circulation, and overall biological balance, not just how the skin looks on their face. So because in the end, the beauty always connects back to wellness. It's not only about appearance, but how the body functions. So I think the next phase of K-beauty is not just about more advanced aesthetic treatments, but about integrating aesthetics with wellness as part of long-term strategies.
Yeah. So you think the dots are going to connect between your skin health versus just the general wellness of, you know, the connection of like your skin being, you know, a big organ and how that connects to, which I think is something fascinating about Korea is how many people like are aware of their liver health and just like there's certain, you know what I mean? Like
Liver health.
well, like when I, you know, like my husband like knows he's like, oh, I have to take care of my liver. And I'm like, I've never thought about my liver, to be honest with you, or like, or it's like your stomach or, you know, just like certain aspects. I think I think you're right that, you know, these dots are going to start to connect and it's going to be, it's not just going to be, you know, here's my skincare routine and the treatments that I do. It's here's my skincare routine, the treatments, and here's the, you know, other like general wellness things that I'm doing, like how it's connecting to my sleep, all of that stuff.
Yeah, so in Korea, in big like university hospital, a lot of foreigners come to Korea to do the health scan because it's very cost effective here.
Totally.
Yeah, they can do everything, every examination here. So,
and it's not. I will talk about this all the time about it, like the healthcare system here and just how amazing it is, and just like the idea of preventative health. Yeah, I have quite a few clients that they want to come and do skincare treatments, but they're also like, we want to do like the whole body scans and like get all of that done because it's affordable and like a quality. And yeah, I think that's right. We're going to see a little bit more of that. Yeah. Are there any technologies that you think are going to become more popular? Like, let's talk in like the next year and a half. Do you think?
yeah, maybe you already talk about everything, right?
Yeah.
So maybe, there's gonna be more. I'm not gonna mention some like specific things, but maybe more like refined energy-based treatments that allows precise customization without excessive downtime, like JERF. And patients increasingly want effective treatment that is very intelligent, not just very aggressive.
Oh, yeah.
And one can be more like regenerative adjunctive and matrix-focused treatment like ECM boosters, ECM-related approaches, or other biological active categories like exosomes. And maybe that kind of market is getting more like bigger, gonna be more like, moving on that direction. So, and maybe some device evolution around delicate areas like periocular areas, perioral areas like that. Those kind of the device gonna be more developed afterwards, maybe in the future.
Whoever can figure out the like under eye situation non-surgically is gonna be a trillionaire. So, like that's the $1 million.
Yeah.
Oh, that's such a problem for so many people. Not a problem, but I feel like that's a focus area for so many people. One more random question. What about like skin analysis? Like you talk about getting more personal. Like, do you think we're going to see better? I don't know. I mean, I think there's a lot of devices that can give you like a skin age. But do you think we're going to see better like baselining and tracking as it pertains to? Because right now I think the baseline is like you can do your skin analysis, but like it's more like the before and after picture is always going to be kind of like the baseline.
Yeah.
Do you think we're going to have any more like technology driven, like, yes, here's the increase in your collagen levels or things like that? Or do you think that's like...
Yeah, if you go to some like conference or like the Congress or like even KIMS.
Yeah, KIMS,
There are a lot of the advanced technology about the skin analysis you can see. So personally, I use some device from the States, the Vizia.
Oh, Vizia, yeah.
And also there's a lot of the other like MetaView, MarkView, and from some like Eve things like that. as you said, those are actually like for the before and after picture. That does not have some like specific
Like actual.
analyze of your skin.
Right.
But maybe someday there's gonna be some more like
More like biology testing.
biological testing.
Yeah.
Using some tests. Which
Yeah, like if you take like literally like put in a needle and see how dense
like kind
your
of
skin is.
like sonograph like that.
Yeah,
Or some
that's cool.
can be some other technology can be combined with that. So
Yeah, because that's like
Maybe.
an area that I mean, from a consumer side, like I don't see a lot of progression in like skin analysis or things like that. But I don't know.
we have to see more deeper inside our skin. So that's
Yeah,
why.
totally. Or maybe it starts incorporating more like other biological markers too. Like maybe your skin analysis is also like, but you have, I don't know, I'm not a doctor, but like maybe it's like, oh, you have low iron or like, something for like, this is why you have inflammation in your skin is because like something else going on, maybe
Yeah.
that's like that wellness thing. I don't know.
That's why I am trying to combine with the skin aesthetic dermatology with the functional medicine.
Yeah.
Yeah, it's gonna be more like popular in this day because when you do some like blood test to see our like the internal balance,
Yeah.
that we can just combine with we can just relate with the skin aesthetic dermatology. So that's gonna be the one of the market afterwards in the
Yeah.
future.
Totally.
Mhm.
I totally agree. I mean, I'd fly to Korea for that. I mean, people are flying just for Botox now. So like, is there anything that, one main message that you would like to kind of leave people with, or one main thing you want people to remember as they're either thinking about coming to Korea for treatments or maybe they live here already and what should they know?
So if I could leave listeners with one main message, it would be this: do not confuse trend with direction. In aesthetics, trends change very quickly, but direction is about where the field is truly going. And in my opinion, that direction is toward healthier tissue, more personalized treatment, and more natural long-term results. And especially for those coming to Korea, I think this is very important. Don't focus on doing as many treatments as possible in a short visit. Focus on what actually fits you and what can continue even after you go back home. So because aesthetic medicine should not end at the airport, as I always say. When you approach it that way, it becomes more than just beauty. It becomes part of a long-term care.